Mark 7 Arterion, injection system syringe installation, filling, and high-pressure connector tubing attachment module. Arterion syringe allows you to easily view the inside of the syringe to monitor the purging of air. To install the syringe, follow these steps. Ensure the syringe piston is fully retracted. To manually retract the piston, press the Enable button, and then press the reverse arrows on the fill strip. If auto retract is on, the piston retracts automatically upon system startup. Insert the syringe in the pressure jacket. Install the syringe with the raised syringe alignment key aligned with the triangle on the pressure jacket. Maintain syringe tip sterility with the dust cap. Do not scrape off dried, potentially contaminated contrast into the head cavity during the syringe installation. Raise and completely close the drop front. Rotate the injector head into the purge or upright position. You can use the injector head handle and the back of the injector head, but not the manual knob, to rotate the injector head. On the injector head, press the Enable button and then press the forward arrows on the fill strip to fully advance the plunger in the syringe. Now that the syringe is installed, let's review the syringe fill process. Do not pre-fill the syringe and store for later use. To fill the syringe, follow these steps. Use the handle to rotate the injector head to the purge or upright position. Remove the quick fill tube from the syringe package. Remove the dust cap from the syringe tip and set aside, maintaining sterility. Attach the short end of the quick fill tube to the syringe tip. When using the standard syringe, the quick fill tube can be attached without repositioning the fast turn nut attached to the syringe tip. Insert the long end of the quick fill tube into the fluid source, usually contrast media. Raise the contrast bottle until the quick fill tube is fully inserted into the contrast. On the injector head, press the Enable button and then press the reverse arrows on the fill strip until the system fills the syringe with the desired contrast volume. Alternatively, you can press the Enable button on the injector head, then press and release the autofill button. The Medrad Mark 7 Arterion will fill the syringe with the pre-configured contrast volume at the pre-configured speed. The volume and speed are configured from the Display Control Unit Options tab. If required, use your free hand to gently tap the base of the pressure jacket to facilitate the migration of air bubbles remaining within the syringe and on the syringe plunger to the syringe tip. Purge all air out of the syringe after filling. Always purge the syringe with the quick fill tube connected to the syringe tip. Turn the manual knob clockwise to remove air from the syringe. Remove the quick fill tube from the syringe tip. Visually confirm that all air bubbles have been removed from the syringe. Tap the syringe after filling to facilitate air removal. Now that the syringe is filled with fluid, let's attach the high-pressure connector tube. When attaching a standard high-pressure connector tubing to a standard syringe, follow these steps. Remove the dust cap from the syringe tip if attached. Insert the high-pressure connector tubing into the fast turn nut. Refer to the operation manual for high-pressure connector tubing specifications. Turn the fast turn nut clockwise to securely tighten the high-pressure connector tubing to the syringe tip. Purge all air from the high-pressure connector tubing by pressing the Enable button and then pressing the forward arrow on the fill strip. Gentle tapping at any connection point may be needed to facilitate air removal. Alternatively, turn the manual knob clockwise to push contrast out until all of the air bubbles have been removed from the high-pressure connector tubing. Ensure at least 3.5 mL of fluid has been purged. If attaching a Medrad Twist and Go high-pressure connector tubing attachment to a Medrad Twist and Go syringe, follow these steps. Remove the dust cap from the syringe tip if attached. Attach the Medrad Twist and Go high-pressure connector tubing into the Medrad Twist and Go syringe tip. Turn the lower nut clockwise to securely tighten the high-pressure connector tubing to the syringe tip. Follow sterile technique principles. Specifically, maintain sterility of the syringe tip and the high-pressure connector tubing. Ensure that the injector head is in the purge or upright position prior to purging disposables. Ensure that the patient is not connected while purging air from the syringe, the high-pressure connector tubing, or engaging or advancing the plunger. Purge all air from the high-pressure connector tubing. Turn the manual knob clockwise to push contrast out until all of the air bubbles have been removed from the high-pressure connector tube. Gentle tapping at any connection point may be needed to facilitate air removal. Ensure that all air has been removed from the disposables before connecting the patient. Rotate the head to the downward position prior to arming and injecting. Do not grasp the drop front pressure jacket, syringe, or tubing to rotate the injector head. For connecting and purging a wet-to-wet catheter, confirm that the injector head is in the inject or downward position. Secure the catheter hub in one hand and the distal rotating lower of the high-pressure connector tubing in the other hand. Advance the piston using the manual knob prior to connecting the catheter and high-pressure connector tubing. Securely tighten the catheter to the high-pressure connector tubing connection while fluid flows from the catheter and the high-pressure connector tubing. Once blood enters the injection tubing,